Hello, good morning. My name is Barbara and I'm your nurse for today. I'm here to do a head to toe assessment. I'm going to check you from your head all the way down to your toes, okay? First thing, I'm going to wash my hands. Okay, I wash my hands. I come back, I'm going to get my gloves. And I've already gathered all my supplies. I have my Snellen chart. I have my hammer, reflex hammer, something to be smelled for cranial nerve number 1, tongue depressor, pen light, and the Wong Baker faces, because since she's small, I want her to tell me her mood. So I'm going to use this as a tool. So first thing, I'm going to put on my gloves and I'm going to check her wristband to make sure I have the right patient. Could you tell me your name?
My name is
Rafaela. Okay, could you tell me how old you are? 5 years old. Okay, do you know where you are? You're at the doctor's. Okay, and do you know what day it is today?
It's Monday.
Okay, Monday. Very good. And do you know who the president is of the United States? Donald Trump. Very good. Okay, also her wristband lets me know that she doesn't have any allergies, so we're good on that. She's very small to be asked for that. I'm gonna go ahead and ask her about her mood. How do you feel today? Can you show me here which face shows how you feel today? Which one? Happy? That one? Okay. All right, very good.
I feel like this.
Okay, very good. All right, so first things first, I'm going to go ahead and ask her to sit up a bit. I'm going to start with her head. Also, as I'm talking to her, I'm inspecting her. I'm looking her face, symmetry, her eyes, any discharge, bruises, lesions, bumps. So she doesn't have anything. I can already see that from the beginning. So I'm going to check her head. I'm going to inspect for lesion, bumps, bruises, pediculosis, dandruff, anything that's any abnormalities. So I'm going to go ahead and check, and then I'm going to ask her, does it hurt when I touch you? Have you hit your head? No? Okay, so good. Everything looks good. The next thing I'm going to do is look at her face again, and I'm going to check her eyes. Okay, for the eyes, I'm going to ask her to look at my nose. Can you look at my nose? Okay, and then I'm going to go like this. We'll check for Perla. Look at, very good. And then look at my nose. Very good. Okay. So the pupils are equal, and they're reluctant to, they react to light. So Perla is fine. Then I'm going to ask her to look at this clip and keep your head still, and you follow this thing. Okay. So tracking. Tracking, 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 tracking. Very good. Look at it again. Follow it. Very good. Okay, so that means her cranial nerves 3, 4, and 6 are working. Now the next thing I'm going to do is that I'm going to check her ears. I'm going to make sure that there's no discharge, no lesions, no redness. Does it hurt when I touch your ears? No. Okay. Let me see. Okay, very good. So that's good. And the next thing I'm going to do is check her nose. Can you let me? I'm going to check your nose, okay? Okay, I'm going to look in there, make sure there's no polyps, no redness, no discharge. Everything is good. Can you go like this? Very good. Both nails are open. Okay. Next thing I'm going to do is check her mouth. Okay. Go ahead and open. Stick your tongue out. Okay, very good. Everything is pink and moist. There's no lesions, no ulcers. Everything looks good. All right. Next thing I'm going to do is check her neck. Okay. Make sure it looks even. There's no swelling. There's no lesions or anything. Does it hurt when I touch? No? Okay. The next thing I'm going to do is check the carotid pulse. Okay. Grounding. Alright. Next thing I'm gonna do is listen to her carotid, and I'm gonna use my bell for that. It doesn't hurt. I'm just gonna listen, okay? Good. Very good. Okay. Next thing I'm gonna do is that I'm gonna check her lymph nodes. Okay. So if I touch you and it hurts you, let me know. Okay. So I do preauricular, postauricular, occipital, submandibular, submental, and subclavicular. Any pain? Now that I'm here, I'm gonna check for trigger. So no tenting. So that means it's good. All right. So we're done with the head part of things. Now I'm gonna check cranial nerves. First thing I'm gonna do is that I'm gonna have her close her eyes. Close your eyes. Put your hand down. And I need you to close your eyes and smell this and tell me what you think it is.
It's chocolate.
Chocolate. Very good. It sure is.
It's so good at it.
Yeah. Okay. Next thing I'm gonna do is I'm gonna ask her if did somebody outside when they check your vital signs. By the way, her vital signs were checked. Everything is within range, so we don't have an issue. Her heart rate is fast because she's a small child. That's why. Did somebody ask you about these letters outside in the hallway? Yeah, they did. Okay, great. So that means her cranial nerve number 2 was working. It's working and it's intact. She's 20/20. Okay. Next thing I'm gonna do is we did number 2. We have to oh, here it is. I'm gonna ask you to close your eyes now, and I'm gonna run something through your face, and you're gonna tell me if you can feel it. Okay? Okay. Can you feel that? Yes. Okay, so that's cranial nerve number 5. I need you to raise your eyebrows. Okay, but let's do it this way. Raise your eyebrows. Okay, very good. Now I'm going to ask you to smile. And then you puff your cheeks. Okay, and now grind your teeth. Grind them. Okay, very good. Okay, so that means cranial number 7 is working. Now I'm gonna do the cranial nerve number 8. I'm going to check. So I need you to cover one ear. And now I want you to close your eyes. Okay, close your eyes. Stand up straight. Okay, close your eyes, and I'm gonna go. Can you hear that?
Yeah.
Okay, let's do the other one. Close your eyes. Close your eyes. Put your head straight. Okay, now I'm gonna do the other one. Can you hear that? Okay,
I could hear this one into that.
Okay, very good. Okay, that's very good. We're gonna do the tongue. Wait, okay, very good. I want you to open your mouth. Stick out your tongue. Put it up, down, side, and side. Okay, so that means cranial nerve 12 is working. I'm just gonna check again. Gag reflex just one more time. Okay, go ahead. All right. Stick out and say ah. Okay, it's right there. So that's 9 and 10 and 12. All right. Now I'm gonna have you move to the edge of the bed, and we're gonna do the wrong burst test. Okay, to make sure her balance is good. Okay, cranial nerve number 8. Come down. Okay. What I need you to do now is stand facing me. Move to the side. Put your feet together. Put your feet together and your hands on the side and close your eyes. Okay. All right. So there's no swaying. That means it's negative. Now I'm going to ask you to walk. Okay. 5 steps, normal, like you usually do. 1, 2, 5. Okay. And go back.
I just said 4.
Okay. Go back.
5.
2, 3, 4, 5. Now I want you to sit at the edge of the bed. And now I'm going to check your reflexes. Okay, reflexes I'm going to do. Have us sit a little bit straight. Very good. And now I'm going to do tricep. Okay. And bicep. Okay.
Don't do it
So
too
there you go.
If you do it
Bicep.
hard, then
So
it
tricep,
hurts.
bicep, and patella. Okay, just relax. It's just gonna be one little bit, and you're gonna do something.
Ow.
Yeah, there you go. Okay. Now relax.
Ow. Ow. Ow.
There you go. Okay. Patella
Down.
is also good. It's there. Her balance is good, so she's able to walk and forth. Okay. Now we have all of that. The tongue, I'm gonna check cranial nerves 9, 10, and 12. So I'm gonna ask you to open up your mouth again, stick out your tongue, and then go ah. Okay. All right. Now open up big, 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 like a dinosaur. Very good. Okay. Gag reflex and all the cranial nerves 9, 10, and 12 are good. Next thing I'm gonna do, I want you to sit. Okay. Sit normal. Okay. I want you to shrug your shoulders. Go like this. Look. Can you do that? Okay, go ahead. So that's cranial nerve 11. All right. So we've done this part. So now I'm gonna go ahead and move to the chest area. First thing I gotta do, lay her down, and I'm gonna take a quick inspection. Make sure everything is symmetrical. There's no lumps, no masses, no lesions, anything that could be abnormal. Symmetrical, everything is good. Okay, now I'm gonna listen to her lung sounds. Okay, I want you to sit up, and I'm gonna listen to your lungs. Okay, all you have to do is breathe normal. So I'm gonna listen to 6 points in the front, side and side, lateral, 1 and 2, and then 8 in the back. Okay, I'm gonna listen for any adventition sounds, anything, crackles, rails, anything that will show me that there's an abnormality. Okay, go ahead and breathe. Okay, again. All right. Sit up a bit. Your little, sit up straight. Like that. Okay, go ahead. All right. All right. All right, now I'm gonna do side. Okay, the other side. Okay, everything is clear. The back. Now you can lean forward. Okay. Okay. All right. Very good. All right. That's one. Also, when I'm in her back, checking out, listening to the lung sounds in the back, I'm going to check her spine, if there's any curvature, anything that would look abnormal, any bump or bruises, any signs of abuse, anything like that. Okay, so that's clear. So next thing I have to do is do her abdomen. So now I'm going to check your belly, okay? Next thing I'm going to do, again, inspect. Okay, everything looks good. There's no abnormalities. Her abdomen is not distended. It's even. There is no discoloration or any rashes or anything that would look abnormal. So now that I'm gonna listen to the lung sounds, and I'm gonna start by the 4 quadrants, and I'm gonna start by the right lower. And I'm going to listen to each quadrant for 5 minutes. Okay. Just relax. I'm listening to your belly sounds. Yeah?
I am relaxed.
Okay. Okay. So everything is normal. She's bowel sounds are all active on all quadrants. So now the next thing I'm going to do is that I'm going to percuss. Okay. If you feel any pain at any moment, you need to let me know. You can grab my hand, or you can tell me to stop. Okay. Okay, very good. Everything is in order. So now I'm gonna palpate. When I push, if it hurts, you tell me. Okay? Alright.
This is really hurt.
I know. That's because you're very healthy. Very good. Okay, so I palpate. Everything is within range. Then also, I'm gonna ask her. Did you go poo poo today? Okay. Do you remember what color it was?
Yeah.
What color?
Brown.
Brown. Very good. And was it like liquid or was it like formed, like little balls, or how was it? Tell me. Can you tell me?
It was like dry and it had little.
Okay. It was okay. It was formed and it was brown. So, the next thing I have to do is listen to her heart. Okay, I'm going to listen to your heart, okay? Sit up straight because I need to listen to this really good. So, to listen to the heart, I'm going to do the points, aortic, pulmonic, herbs, tricuspid, mitral, okay? And I'm going to say which one sounds louder at which point. So, here's aortic, and S2 is louder than S1. Pulmonic, same thing, S2 louder than S1. Herbs point, they're equal. Tricuspid, S1 is louder than S2. And mitral. And that's the point of apical pulse where you listen for a whole minute. Okay? There's no gallops, there's no abnormal sounds. Her heart is good. Alright. We went to the belly, we did this, we asked, how about, did you go pee-pee? Okay, can you tell me how was your pee-pee?
It was yellow.
Yellow. Does it hurt when you go pee-pee?
Mm-hmm.
And when you go poo-poo, does it hurt? No? Okay, good. Alright, so that means everything is good. So now, I need to check range of motion on the arms. I forgot about that. So I'm gonna look for her arms. Skin is warm to touch and her arms are symmetrical, and then I'm gonna go ahead and move her arms. If it hurts, you let me know. Okay? So range of motion is good. Range of motion. Now I'm gonna ask you to squeeze my fingers as tight as you can. Grip is really good. Now I'm gonna ask you to put your arms up like this a little bit, and I'm gonna push down and you go up against me. Very good. Now we're gonna do it the other way. You push down and I push up. You push down. Very good. She needs resistance. So we're good with that. Capillary refill. Have to check her nail beds. Risk less than 3 seconds. About here. Okay, good. Very good. Less than 3 seconds. Okay, we asked about here. So now I'm gonna go ahead and go back and look at her legs. Make sure that there's warm to touch, there's no lesions, there's no bruises, no cuts, no bumps. She does have a little bruise right there. What happened here? Do you know? Did you hit your head? Your leg right there? Okay. Well, it's an old one. It's not like a fresh one, so she probably hit her leg running around. Okay. Legs are symmetrical. There's no lesions, no rashes, no bruises. There's no edema. I can see that right away. I'm going to check range of motion before I do anything else. So I'm going to ask her to bend. Does it hurt when I do that? No? If the knees hurt, you're going to tell me. Okay. Now I'm going to ask you to raise this leg up. Can you do that? Up. Bring it up. Okay, very good. All right, go ahead. Now do the other one. Very good. Okay. Now I'm going to ask her, I forgot to ask you upper cerebellar and lower cerebellar. Have a seat. I need you to pinch like this. Look. As fast as you can. Can you do that? Very good. Again. Very good. So that means her upper cerebellar is working. There's no problem with that. And now I'm going to do the lower cerebellar. So I need you to put your heel, the heel of your foot on your shin and run it down. Can you do that? This part has to go here and you come bring it down. This part, like that. Okay, run it down. Very good. Okay, do the other one. Very good. Okay, so that's the lower cerebellar. It's working. Everything is fine. Now I'm gonna check range of motion on her feet. I want you to go like this with your feet. Can you go round and round? No. Okay, hands are good. With your foot. Can you go round and round with? All right, very good. The other one. Very good, very good. Okay. Pulses. Okay, that's good. And here, dorsalis pedis. Okay. And that one too. And now, I'm gonna ask you. I'm gonna put your. This is like a gas, so you push down like a car. Very good. Let's do this one. Very good. Now, I'm gonna put up and you. I push up and you, the opposite. So, no. I bring it down, you push up. Can you do that?
Yeah.
Up. Push up. Like this. Can you do that? Okay, there you go. Do it. Very good. Now this one. Do it. Very good. Capillary refill on these. Everything looks good. She doesn't have any lesions. There's no cuts or bruises. Everything looks good. No problem in between the toes. No tidia pedis or anything like that. So she looks really good. We checked the pulses. We did capillary refill. I think we're good. Clear sounds, hard sounds, where everything was good. So I think I'm done now. I'm gonna make sure I leave her in a comfortable position. Cola is gonna be within reach. I'm gonna thank her for her time, and I will step away. That's all. Thank you.